Hello, a very warm welcome to you out there. Thanks for joining us. And I'm delighted to say we're joined by highly esteemed London-based consultant, rheumatologist, Mr. Gerald Coakley, to chat about his very exciting book that's set to be released, entitled Living with ME and Chronic Fatigue Syndrome. So, Mr. Coakley, thank you so much for joining us this afternoon. And before we get into what the book is about and some insight into the book, if you'd like to maybe provide some background information about your practice and experience.
Sure. Yeah. Well, thank you very much for the invitation. So I'm a consultant rheumatologist, and I've been based in London for most of my career. And I work mostly in the NHS, but I work privately as well. And I guess most of my time I'm seeing people with, what rheumatologists generally see, people with rheumatoid arthritis and other types of inflammatory and autoimmune disease, lupus and inflammatory muscle disease and that sort of thing. But I became interested in ME, or chronic fatigue syndrome, about 20 years ago, and I've maintained that interest ever since. So it makes up a part of my practice, but probably not the main part.
Fantastic, Mr. Coakley. A raft of experience, and we're very excited to chat about your book, Living with ME, which stands for myalgic encephalomyelitis. And the first question about that, maybe then, Mr. Coakley, what insights does this book offer with regards to myalgic encephalomyelitis and chronic fatigue syndrome?
Well, it is a bit of a mouthful, isn't it? But it's myalgic encephalomyelitis. Yeah. So, well, look, the book's aimed at people who have disabling fatigue and either believe they have ME, CFS, or have recently been diagnosed with the condition and want to find out more. And what we've tried to do in the book is to set out clearly what's known about the condition from a scientific point of view, and to set out the facts as they're currently understood. We also review scientific theories regarding causation and the role of various medications and supplements. And my co-author, an occupational therapist, Beverly Knops, and we've tried to be honest about the condition, neither scaremongering about it nor raising false hopes about the likelihood of an imminent quick fix treatment, or for that matter, for many people, a full recovery.
Fantastic. So I suppose it's really kind of giving an insight into the reality of maybe living with these conditions. And why is it so important, do you think, to highlight these two specific conditions?
Well, it's actually one condition. So they're just different terms for the same thing. Myalgic encephalomyelitis is one term that many patients and patient charities prefer to use. Many doctors prefer to call it chronic fatigue syndrome, but basically it means the same. And it's actually there's quite a lot of it about. So it's thought to affect around 17 million people around the world, and in the UK it's roughly 250,000 people. So that's quite a lot of people. And we're in a situation with this condition where medical science still cannot explain why it is that some people get ME, CFS. And at the moment, there aren't really any very effective treatments. And, our experience is that while many people with the condition go on to have a reasonably good quality of life with the right support, around a quarter of them are so severely affected that they're housebound or even bedbound for months, years, or in the worst cases, decades. My experience is that it's a condition that's not well taught or explained at schools of medicine and nursing, nor particularly well understood by the majority of healthcare professionals. And I think the most commonly held view is that it's a psychiatric disorder for which conventional medicine has nothing to offer. And we really think that's a shame. It leaves too many people with the condition feeling abandoned by their healthcare providers.
Absolutely. I suppose, do you think maybe in recent years that more light is being shed on this condition and more knowledge or awareness is being spread about it, or?
Absolutely. I think there are reasons to be optimistic right now that it's a condition that's coming into real focus, particularly since the COVID pandemic. And I think it's a timely moment really to be discussing and writing and thinking about this condition.
Absolutely, Mr. Coakley. And it leads nicely onto the next question then for any patients who may be suffering from this condition, then how can this book help them?
Well, we've tried to set out the book in an easily digestible form. As I said, it's aimed at people who've got the condition, and often they're not in a great, it's not feasible for them to focus on, long pieces of text. So it's broken up into manageable chunks. We have a chapter describing what we call classical ME or chronic fatigue syndrome, most often triggered by a viral infection like infectious mononucleosis, the virus that causes glandular fever. But there are other viruses and other infectious agents that can do it too. Then we review related conditions which are often associated, like fibromyalgia. That's where you have widespread pain associated with sleep and mood disturbance. We also discuss joint hypermobility, which it can be linked with a genetic disorder called Ehlers-Danlos syndrome, which is also frequently observed, where people have unusually stretchy joints and soft tissues. We look at another linked condition called POTS, or postural orthostatic tachycardia syndrome. And that's where people experience a racing heart or faint feelings on standing. And this is commonly described in people with ME. And then we review something called MCAS, so mast cell activation syndrome. This is a condition in which severe allergic reactions are associated with symptoms like fainting, urticaria, that's hives, itchy, sort of wheals on the skin, wheezing, crampy abdominal pain. And these are symptoms often described by people with ME. And, our experience is that anyone who's new to the condition, who starts to look online for more information about it, will soon find in forums and charitable web pages references to all of these conditions. So what we've tried to do is to present them in a digestible form and put them in context so that people have got a framework really for making sense of a complex field when they're trying to understand what might be wrong with them.
Fantastic. And I really love the way there, Mr. Coakley, you say that it's very digestible, very accessible for any type of patient, any type of reader. I think that's fantastic. So that'll be, I think, reassuring for patients to hear that for sure. And then I suppose our next one then, what was the inspiration behind the book's publication? Where did the initial idea originate from then?
Well, actually, I was approached by Penguin. So they have a series called Penguin Life Experts. It's a non-fiction series which aims to help people live well and empower them to help take control of their health. So they've got titles like Preparing for the Perimenopause and Menopause, Managing Your Migraine, Keeping Your Heart Healthy, Understanding Allergy, Managing IBS. And so this is one of that series. And they approached me because they thought there was a need for a concise book summarizing the current state of play with ME/CFS, and I thought they were absolutely right. And so it was an honor to write it for them with Beverly.
Fantastic. And how was the writing experience and the journey? Well, it must have been very rewarding.
Well, it was very interesting. I learned a lot, actually, as is usually the case when you write something or when you teach something, you learn because in order to explain something, you have to read and think. And in some ways, writing the book made me think afresh about a condition that I've been treating for so many years. But just trying to update myself was quite a rewarding process.
Absolutely. And then for you, the readers, then, Mr. Coakley, would you say that there is any specific patient profile that you would recommend this book to?
Well, we've tried to make the book as broadly applicable as possible. It considers children at school, young adults at university, adults in employment who develop the condition. And so really, whatever context people are in, we've tried to explain how it is that people might adapt their circumstances so that they can cope with, getting on with life and also with the condition. It's probably most useful and applicable to those who are in the mild to moderate category. That means where they are impaired from activities of daily living, vigorous activities of daily living, but probably still at work or still in education. But there are people who are more severely affected, and there's so little information or support offered by healthcare systems for that category that we think the book could help them too.
Fantastic. Mr. Coakley, I suppose then any patient out there who might feel as though they might have chronic fatigue syndrome, how important would you say is an urgent or early diagnosis? And how exactly would it be diagnosed?
Well, I mean, I suppose that what we're kind of driving at is what is chronic fatigue syndrome, and how do we identify it? So, I mean, I think the key thing is that it's different from feeling tired all the time. That's a very common complaint amongst the general population, and that's not what we're talking about with ME/CFS. There are four main features of CFS. The first being debilitating fatigue, not caused by excessive physical, emotional, or social exertion, and not significantly relieved by rest. Secondly, and really a hallmark of the condition, is the phenomenon known as post-exertional malaise, or some people call it post-exertional symptom exacerbation. And this means that after any unaccustomed physical, mental, or social activity, there's a worsening of physical symptoms, including fatigue, typically delayed by hours or even a day or two. And then the final two features are unrefreshing sleep and cognitive or thinking difficulties, which some people describe as brain fog. That means problems with finding words or numbers, remembering things, or multitasking. So those are really the main features that we're looking for. And then there are some, medical conditions that we need to exclude, and that's why a physician like me might be involved to rule out things like anemia, thyroid disease, diabetes, celiac disease, those sort of things. And then we, if those are ruled out, and the four features I mentioned are present, then that's what we call ME/CFS. And then we go on from that to think about severity. So mild ME is where people are independent. They can work or participate in education, but to do this, they've stopped most or all leisure, sporting, or social pursuits. And typically they use the weekend just to rest. And then moving on from that, we have moderate cases where, in addition, people have reduced abilities. They've usually stopped work or education, and they often need to rest or sleep in the afternoon. And then the more severe categories are those severe patients who are largely housebound, may only be able to, for example, brush their teeth or wash their face, as that'll be their whole activity for the day. And then the very severe group are people who are bedbound and dependent on carers for their personal hygiene, for eating. They're often completely intolerant of light and sound and have to remain in a darkened room, and some even need to be tube fed. Fortunately, that last group is very rare, but it does happen.
Absolutely. Well, I think it's fantastic to shed light on this. It is a very debilitating and severe condition, Mr. Coakley. So the more awareness, the better,
Yes.
Absolutely. And then I suppose you touched briefly on this, but maybe the known main causes, if any causes are known, of chronic fatigue syndrome.
Well, yeah, I mean, the short answer is we don't know. But what we do, one of the chapters in the book looks at the current theories regarding why people develop the condition. We cover the role of genes, environmental factors like viruses and bacteria, theories around immune disturbances. There's a hypothesis around mitochondrial dysfunction. Mitochondria, the little tiny intracellular organelles which generate and provide energy to all living cells. And one hypothesis is that there's a problem with the mitochondria that might cause this. Then we explore theories around lactic acidosis, the generation of excess lactic acid in muscles or in brain, and that's another theory. And then there's some evidence around hormonal factors and how stress might affect hormones. So those are probably the main areas that we explore when we're trying to set out the causative factors.
Fantastic. Well, Mr. Coakley, a fascinating insight, a very important insight, I think, for this condition. The more awareness, for patients, the better. And I suppose, well, your book entitled Living with ME and Chronic Fatigue Syndrome, of course, is set to be released on September 22nd. You can pre-order on Apple Books. And if anybody would like more information about chronic fatigue syndrome or some more areas of expertise that Mr. Coakley deals with, you can head on over to his Top Doctors profile on www.topdoctors.co.uk. Thank you very much for joining us today, Mr. Coakley.
And thank you.